Okay, everyone. So thank you very much for joining us today for this online lecture hosted by Mashav and MCTC. Mashav is Israel's Agency for International Cooperation. My name is Sarah. I'm the Deputy Director of the Mashav Carmel Training Center here in Haifa. And we're really excited to be hosting Maya Kroitoru, who will be talking about exploring the new normal, COVID-19, and disaster mitigation. So just a few things before we start. First of all your microphones have been muted. So if you'd like to interact and you have any questions or any comments, please make sure to use the chat at the bottom of your screen. And we will try to address these questions at the end of the lecture. We are recording the session. So if anyone has missed this session, we'll be putting up the recording on our website, and you can have a look at that as of tomorrow. And I think we will begin. So what I'd like to do first is introduce Maya Kroitoru. She's an independent consultant on humanitarian affairs, has over 10 years of experience designing, executing, and adapting programs for vulnerable populations. She served as the Director of Operations and Planning at the American Jewish Joint Distribution Committee's Disaster Response and International Development Department. In this capacity, she developed disaster mitigation and recovery programs in Indonesia, Philippines, and Nepal. Maya holds a BA in International Relations and an MA in Middle Eastern Studies. And I'm going to pass the floor on to Maya. Maya, thank you so much for joining us, and thanks everyone else for joining us. And away we go.
Thank you, Sarah, and it's certainly a pleasure to be here today. I'm just going to go ahead and kick off. While there are many countries, as you know, who are currently flattening the curve for the COVID-19 disaster and are loosening restrictions, many indicators suggest that the socioeconomic impact of the crisis continues to worsen, and it's impacting some of the world's most vulnerable populations. So that's really the focus of my presentation today. And I hope that it will give you some insight into disaster response, mitigation, and recovery as we're all trying to navigate the new normal together. I'm really interested in hearing from you and your questions after this presentation is over. And just one little caveat, I have a new baby at home. He's 6 months old, and so there's a chance he'll make a cameo appearance at some point during this presentation if he needs me. Okay. All right. So this slide shows the emergency management cycle. As humanitarian workers, we're really experienced in singular events, a disaster, a typhoon, something that generally has a very clear beginning and somewhat clear end, where we can say, okay, the dust is settled and it's time to start thinking about a recovery. Now, within the recovery, there will usually be some setbacks along the way. One classic example is the cholera outbreak after the Haiti earthquake. But overall, as you can see from this slide, the recovery is cyclical. The trajectory is somewhat linear. In contrast, the COVID-19 disaster has a very different trajectory. It's not just a global medical emergency. It is completely upending the socioeconomic life of communities in its path. And it's completely discombobulated the recovery. So this is what it feels like, I think, if you're a humanitarian worker right now, okay? You're in this room with lots and lots of wires that are all entangled. You don't know where to begin, and you don't know where to end. And, or you don't know when it's going to end and when we can say, okay, the recovery can begin. And at the same time, we're asking ourselves a lot of really tough questions about both the emergency response and the recovery. And I just want to share with you some examples of these questions. Is a reprieve and a lockdown the beginning of the recovery? What happens if there's another outbreak? Will all of the humanitarian gains that we had achieved be lost? And if so, what do we do to regain those achievements and help vulnerable communities? How can we best assist communities who are experiencing other natural disasters, such as cyclones and floods, simultaneously? Are traditional disaster response packages, such as cash assistance, even relevant or effective if the local markets are closed or local agricultural output isn't sufficient to meet community needs? Same goes for hygiene packs. Are they going to be useful if a community doesn't have access to clean water? How can we receive input into humanitarian interventions for communities who are in lockdowns and do not have regular access to internet and phone communications? What about migrant and refugee communities? They are particularly exposed and vulnerable right now. How can we best assist them along with other vulnerable populations? These are just some of the many, many questions that are being asked. And I think that the answers to these questions that we're figuring out along the way have long-term ramifications for disaster response and mitigation. This is a protracted crisis. It'll take probably a minimum of 2 years, that's what the estimates are, just to get the medical emergency under control. And maybe at that point we can think about starting to get to normal. So in the meantime, different communities within different countries are in different places within the trajectory of the recovery phase. So it's really important that we get this right now, because where you begin impacts where you end up. And so the humanitarian interventions that we start right now will have a major impact for communities for the next 5 years minimum. So I really see this as an opportunity to establish strong local communities that are better equipped to respond and recover from crises as it evolves, and a little bit more independently. And so in this presentation, I would like to offer some ideas from the disaster management toolkit that could help us guide our humanitarian response as we go about it. Okay, so a little bit of definitions. Right on your screen, you should see a definition for disaster risk reduction. I'm going to read it out loud. Actually, I'm not going to read it out loud. The bottom line is that it reduces losses in lives and the social, economic, and environmental assets that a community has. That's the main policy goal of disaster risk reduction. Now, in 2015, the United Nations gathered in Sendai in Japan all of its stakeholders to develop a new, or to basically update the policy in disaster risk reduction. And at that stage, in 2015, it expanded the policy to include global health security, and that's really crucial in the face of a pandemic. It also did another very crucial change. It asked countries and their communities to focus much more on risk and less so on the disaster response. Why is that? Usually by the time you get to a disaster, it's just too late and most of the damage has already been done. So the challenge we have is to equip local communities to start now, to think about what tools they need in order to both respond to the disaster, as well as have a short and long-term recovery and ultimately bounce back faster. And I believe that the most crucial tool that we have in this goal is community-based disaster risk reduction. Now, this is an illustration that was taken from a project that I did in Indonesia that taught local communities disaster risk reduction. And it's a volcano that's erupting in the background. And I used to use this image to tell a story about how long it can take external assistance, whether that be government assistance, local NGOs, international aid workers, to reach a community. Now, oftentimes, in this case with the volcano, there'd be volcanic ash. If it's a typhoon, like we experienced in the Philippines with Typhoon Haiyan, it can be a significant amount of debris from coconut trees that can take weeks to get through, especially because in the case of the Philippines, chainsaws were illegal because of deforestation issues. right? So best case scenario, it can take upwards of 1 or 2 weeks to reach a community that's been isolated by a disaster, and even more so for a community that's already been isolated. And I use this story to demonstrate the fact that, you know, it really is up to the community members to do their own disaster response and recovery. They are the first responders. They're there, right? It takes everybody else much longer to get there. This story is true now, but it's also losing its relevance, because what we're seeing is that aid workers are now stigmatized as virus carriers. International borders are closed. In the case of national or local assistance, we are seeing some communities that have decided on their own to close off the main arteries and roads that reach them in an effort to ward off the virus. They're on their own. Lockdown has essentially stagnated communities and prevented external assistance from, you know, NGOs. Government and army can, of course, achieve access if they want to, but it's local grassroots efforts that have a hard time accessing it. So it's, what I'm trying to say with all of this is that if before we could rely on external assistance to arrive a little bit later, that expectation is pretty much thrown out the window. And right now, the major effort needs to be focused on community-based responses, because they really are the anchor point. They're on their own right now. So what is community-based disaster risk management? What you'll see here on your screen are some of the major components. I want to first talk about the theory of change. It's quite simple. A community that functions well during periods of calm will be best positioned to respond during a disaster and bounce back faster. Why is that? Because it's participatory. Community members come together and they themselves put together risk assessment tools. They themselves look through and analyze the capacity of their community and make a vulnerability analysis depending on what type of hazards. If they live close to a river, if there's a volcano in the background, you know, they make an effort to do forecasting, connect to early warning systems that might exist on a national level. There also apply sphere standards, which are the standards for humanitarian action, and study them, right? And this is really important because sometimes in our effort to help one another, we can indirectly cause trauma by asking questions about what happened that might be very difficult for people to regurgitate and to say without being in a safe space. But of course, we need to know what happens in order to know how to respond, right? So the techniques in asking these questions and in being there for one another as a community can be taught through the sphere standards. The other piece that I think is really crucial is family level preparedness and relief and rescue, right? Helping a family think through what are the different pieces of equipment that they need in their go-to bag. Make sure, do they have identification papers? If so, let's make sure to have those included, so that when you're running, if you need to evacuate, you need to take those critical pieces of paperwork. And it also looks at the longer term disaster mitigation and preparedness. So asking questions like, if you only have one source of income in your community or in your family, is there something else that can be done if that particular source of income is very vulnerable to disasters? Is there something else that you can start now that would give you some sort of cushion that you can fall back on? Those are really the main components of community-based disaster risk management. And this is a photo that I took from a community meeting in the Philippines, in Palawan. And what I love about it is that you can see how transparent the process is, because everything is being written down. Every single idea that a community member has is being written down on those yellow pages that you see. And people are engaged. It is their process. You can see on the right-hand side, the women's t-shirt says, prepare, prolong, protect. That's an amazing logo, amazing motto to follow at this stage. More examples. This is Indonesia. When this is in North Sumatra, and you see in the background a volcano called the Sinabung volcano that was exploding for 6 to 8 years. And the ash had taken out the livelihood, the crops. And so here is a photo of cabbage, a certain strain of cabbage that can withstand volcanic ash. And so by planting that cabbage, the families in the area could have income as well as their own nutrition, source of nutrition. Excuse me. One last example from the Philippines, which I think is really crucial. A good community-based disaster risk reduction program has the capacity to pivot. And in this case, an organization went into the Philippines to design a disaster risk reduction program. And it noted right away that there was a significant amount of people with disabilities and elderly living on the island. So they brought them to the government meetings so that they could say themselves what their needs were in a disaster. And in this case, he had said that he needed a helmet, that he was able to survive the typhoon on his own, but in the next, if this were to happen again, he would like to have a helmet so that the helmet would protect him from the debris that was flying from the wind. And so we procured those supplies, and we noted that a couple months later through monitoring programs that while yes, they were better prepared for a disaster, they were having a harder time, people with disabilities were having a harder time bouncing back and regaining their livelihoods. And this was not an area that the organization had expertise in. So through international partnerships, through research, through information from the national government, they were able to pivot and provide the resources to people with disabilities to develop their own enterprises. And here we have an example of a barber shop. This is an example that was taken just a couple weeks ago in the Philippines from the International Institute for Rural Reconstruction. And here they're supplementing government food aid by focusing on nutrition and helping urban families develop kitchen gardens. So those are just some examples of what community-based disaster risk reduction can look like, because in a way it's anything and everything that a community would need in order to function well during regular times. So I think the critical piece here is trust and a facilitated process that community members can really input into. And in order to effectively implement a disaster mitigation and response program in any community, we need to think about together about the question that's written here on the PowerPoint: how is risk changing in the face of the COVID-19 disaster? And I have some ideas that I want to share with you, and I'd be interested in hearing what you think about these ideas in the question and answer. So the first thing that we know already before COVID-19 is that we've got to be prepared for multiple hazards simultaneously. It's much easier to see this right now, right? There was a cyclone in Vanuatu recently that has stretched responders quite thin, as well as government resources. Somalia is currently experiencing a triple crisis: flooding, COVID, as well as locusts. In the Democratic Republic of Congo, they were ready to announce the end of Ebola when a new case was discovered. And as a result, they're now dealing with two public health crises, both Ebola as well as COVID-19, in addition to ongoing conflicts. And we have the incoming Atlantic hurricane season and the monsoon and typhoon seasons in the Asian Pacific, right? And we know that this is a minimum of a 2-year medical emergency. So we need to start thinking about right now what resources are needed in order to simultaneously manage more than one disaster in any particular community. This was also something that was clear before COVID, but it couldn't be more clear right now. Hazards cross international borders. They do not respect borders. Viruses certainly do not respect international borders. And it is crucial that international collaboration is put into place that is connected to regional and local efforts on a community-based level, so that everything can be activated and information, so that we can respond quickly. We're also seeing disaster domino effect that's impacting gender-based violence, public health, food security, increased costs of supplies. And I want to focus a little bit on each one of these issues. So we know that lockdowns are a pressure cooker for gender-based violence. If there were domestic issues between intimate couples beforehand, those are likely to get worse. Many charities have already reported that there's been increased calls for help in this arena. We also see that any crises will exacerbate existing inequalities, whether that be towards women and girls, or people from the LGBTQ community, people with disabilities, older adults, refugees, the extreme poor. Lockdown is currently decreasing these people's options and doing away with the resources that may have helped them in the past. And I think there's a critical lesson here to learn from Ebola. While the infection of Ebola reported more cases among males, females were disproportionately affected by the social and economic consequences. Why is that? It's because women generally have lower levels of education and more limited marketable skills. And their income generating activities were more vulnerable to the Ebola-related economic shocks. And that similar impact on women is very much expected, and we're already seeing a lot of that come to fruition within the context of the COVID-19 pandemic. Public health. What we're seeing, and we're likely to continue to see a trend of this, is increase in sickness and disease that could have been prevented by routine healthcare. A lot of vaccination programs have been sidelined as a result of COVID-19. We are seeing now that polio vaccinations have stopped in many countries, and that's largely because teams that were in place to do these vaccinations are now responding to COVID, or somehow were themselves impacted by the virus and are therefore unable to provide these services. I live in Tel Aviv, Israel, and my infant child was able to get his most recent vaccine for polio 2 weeks ago, but it was on a very limited basis. We had to take a lot of precautions to assist him, and thankfully we were able to do that. But in many other countries and in communities around the world, this is not possible. And therefore, we see that there could be cases of illnesses that may have been very easy to avoid taking place, disabling people, and challenging public health indicators. Food security. With a lot of communities, individuals that used to work foreign workers from Nepal and India, for example, that used to work in the Gulf, have gone back home. In the case of Nepal, I recently spoke to a partner organization of mine there, and they told me that, this is a photo that was taken from Nepal that you see here from a rice paddy, that not only have those that were working in the Gulf returned back home, but also those that lived in Kathmandu also went back to their villages. And so not only are the remittances that they used to send home down, but there's also an increased demand on local food resources that was completely unanticipated when the harvest came into place. And so a lot of community-based programs are now trying to think about what kind of quick measures can be done right now on the agricultural level in order to ensure that at least locally, the villagers that have come home have food sources at home. We're also seeing, just on a global level, decline in economic activity combined with trade restrictions, limited national budgets, reduced household incomes. All of this is going to lead to a rise in food prices. In fact, the United Nations most recently tripled the size of its humanitarian aid appeal, citing a global food shortage created by the virus. So I think many of us have already experienced this increased costs of critical supplies, including face masks. This is largely due to the disruption of the supply chain coupled with increased demand. We've even been seeing cases where traditional donor countries have actually requested from their partner organizations to donate to them any leftover supplies that they might have. Some countries have, and their foreign aid have decided also to forbid their foreign aid assistance from purchasing critical supplies that are needed. And I just read this insane statistic from Uganda. I don't know if anybody from Uganda is on this call, but a pack of 50 disposable masks that used to cost $2 now sells for $40 in Uganda. So you can imagine how difficult it is to take some, the very basic levels of prevention needed in the midst of this crisis. And I want to touch on just one more aspect of this crisis that I don't have any direct expertise in, but you can't have a presentation about the COVID pandemic without discussing it. This is from the screen of the United Nations. The UN is tackling an infodemic of misinformation and cybercrime in the COVID-19 crisis. This is really unprecedented on a global level and is probably one of the main issues that any disaster mitigation response program is going to confront as they try to create trust and communicate effectively with populations that may have different levels of COVID in their communities to begin with, that are under lockdown, that are suspicious. And this just really emphasizes another important lesson learned from Ebola, the importance of community engagement, of having programs like disaster risk reduction, community-based disaster risk reduction programs in place, because they are a tool for disseminating information and engaging the community in a way with the community that works for them, so that they understand the implications and can take on preventative measures themselves. And so I wanted to put that out there on this slide. So as I come towards the conclusion of my presentation, I want to just go back again to discuss why community-based disaster risk reduction can be a tool in combating COVID. We've talked about some of the risks. We've talked about some of the trends that are happening globally and why it is difficult to implement emergency response and recovery programs. And I think that if we start to think long-term now by putting in place community-based disaster risk reduction programs that are then have the capacity to pivot and to take on different livelihood programs, or to take on community-based community health worker programs, which was also have proven to be very effective, especially in the previous Ebola pandemic. That if we do that now, we're probably equipping communities to better manage their own affairs now and in the future as this evolves. And the reasons are listed here. Community-based DRR enables communities to maintain preparedness for global disasters. It helps ensure participant voices are included in the response, which is really crucial. It's meeting the changing needs of the most vulnerable population. And like I said earlier, it has the capacity to pivot and adapt depending on what the needs are as they emerge. All that being said, it's important to also take into consideration new mitigation measures. And I want to offer some tools for doing that within the context of a community-based response, but this is just some tools, and this is certainly not a comprehensive list. It's really important that we receive input from vulnerable populations within each community about what the response should look like within their community. And given in the context of a lockdown and social distancing, and depending on what community you're working in and what their access to internet and communications are, this is going to be a really, really challenging aspect of the response. And even in communities that do have access to telecommunications or internet, it's really going to be very important to think about the concept of do no harm, do less harm. And when you're posing certain questions to women, girls, other vulnerable populations who might have their families surrounded by them and may not be and will therefore have a biased response in how they're responding to their questions, the questions that you ask them, it's going to be a really challenging part of this process. And certainly community-based disaster risk reduction programs that were in place before, which now allowed them to therefore get to know their community members and some of the particular challenge that are experiencing, will have sort of a step up in the game in that respect. But it's something that we need to be careful on as through and through. It's also really important to think about how food distribution is accomplished, what types of measures should be taken to account for the special needs of people with disabilities, of women and girls who might be responsible for caretaking at home and not able to go outside. What do they need in order to withstand this crisis? And what do we need to do as a humanitarian community to help reduce barriers to critical services and take targeted actions based on their input so that they have the services that they need to get through and to thrive. And I think, and I think just as the last piece, this isn't relevant in every community, but there also might be some policy pieces that can help women significantly, as well as other populations. Things like paid leave for primary caretakers, right? What do we do about people who are caring for elderly, people with disabilities at home, those that used to have a place to go and now no longer do? All that while still having to bring in income in order to feed a family. And these are just some things to keep in mind if you are going to be implementing a community-based disaster risk reduction program. And I think these mitigation measures could really help in this time. So I want to finish with this drawing that I took from USAID training for children on disaster risk reduction within schools. I think that enables us to kind of finish on a more positive note. There's been a lot of great work that has been done in this field, a lot of training on all levels, including school-based. And I think that if we do work together as local communities and as a global community, we can see massive improvements in humanitarian indicators. Thank you.
Thanks so much, Maya. Thank you so much for that presentation. I'd like to open up the floor. If you have any questions, please feel free to write them out in the chat at the bottom of your screen. There's a chat where you can write down some of the questions. And maybe I'll start with one question here that I see is, how would you suggest now in this social distancing lockdown time, could you suggest any tools for monitoring and evaluation of programs when we have to be sort of far away and in social distancing? What can we do for that?
I think that'll largely depend on what sort of communication tools the community that you're working with has in place. I think anything that is being done needs to be extremely user-friendly and minimal amount of time. It takes a minimal amount of time amongst the participant. So there's some great applications that can be sent where people can fill out surveys on their phones, and you can get critical information that way. And that's also a way to protect people's privacy, because in contrast to phone conversation where you can have to speak out loud, and especially if you're living in a crowded area, chances are other people will hear you, and therefore your response will be biased, and you may not get the information that you need to do ongoing monitoring and to be able to pivot as needed. I think with communities that don't have these access to this kind of communications, it's going to be extremely, extremely challenging. And I'm sure that there's people on this call that could help answer this question, depending on what their community is and if they've been working. And this is why, again, I really wish that every community already had a community-based disaster risk reduction program in place. Because if they did, they, you'd be able to say exactly what it is that my community, different types of measures that could take place in the community that would work with that particular community. And it's going to vary community by community, person by person.
Thanks, Maya. Thank you. I think access is such a big problem. We're doing everything on Zoom and everything online, and yet, like, as you suggested, so many vulnerable communities and populations don't have access to technology and to what we're saying. Everything is going online, but what do we do with those people who don't have access? I think it's an interesting conversation to have. We do have a question here. What do you think about the community-based early alert systems instead of disaster mitigation?
Well, I think the early alert systems have to be integrated into disaster mitigation program to be effective. Because and again, going back to communications, the way I've seen it work, and as an example in the past, an early warning system will activate something on a community-based level. And let's say you have a siren, or somebody announces on a loudspeaker that there's an earthquake or a typhoon coming. There's going to be many people in that community that may be hearing impaired, that aren't going to be able to access that information. And so if you link a community hazard early warning system into disaster mitigation program, you're much more likely to get that critical information to the people that they need it. Whether that be a walking phone tree where neighbors come and knock on each other's doors and say, this is what's happening, go to the evacuation spot that has been agreed upon in advance, that's so that you can be safe. Make sure you have your safe backpack and the equipment that you need for this particular disaster, and essentially open up this disaster communications phone tree. That is either physical or it takes place over phone, in order to ensure that everybody has that critical information. So, yeah, I think it absolutely needs to be integrated to be the most effective.
Thanks, Maya. We have another question here. Based on your experience, which is easier to reduce risk? Earthquakes, typhoons, etc., or COVID-19?
It's a good question. Look, I think because COVID-19 is a global pandemic that's affecting the entire world in different ways, we're seeing basically the system being squeezed, right? So blind spots are appearing, lack of resources are a huge issue. If in the past we were able to say, okay, a typhoon took place, it impacted A, B, and C countries over this amount of days, right? They're missing this set of supplies. We know that we can get those supplies from United States or another country donor. It's just a question of time. That may not be the case now. Everything is being squeezed. I think the line between sort of the within the disaster response supply chain has really been blurred, right? It's not, for lack of a better word, it's harder to bring supplies between the haves and the have-nots, right? Warehouses are isolated, and every country now has deep needs. So I think that the challenge with COVID is that it's happening at the same time. It's squeezing all of our social systems, and I think because of that, this is an unprecedented disaster response that is much more complicated than typhoon, earthquake, and so on. All that being said, you know, if you're impacted by this disaster, whether it's COVID-19 or an earthquake or a tornado, it's likely that your life has been completely upended, and the trajectory of your future has been changed accordingly. And there's no way to compare that for any particular individual.
Okay, thanks, Maya. Another question, which is, what is the mechanism for various humanitarian organizations to coordinate services? You spoke a little bit, I think, about international collaboration, and if you can mention some mechanisms for humanitarian organizations to collaborate.
That's a very interesting question, because it's very interesting. So the mechanism is OCHA, the Office for Coordination of Humanitarian Affairs, which is a United Nations organization that has the mandate to respond. Generally, it needs to be invited in any particular country to start to go into emergency response, right? The Philippines or whatever country it might be needs to say, all right, I want international assistance, let's activate OCHA. And then a cluster system goes into place, which has proven to be very effective in many countries. It has not been activated fully in this disaster. It's the WHO that has the mandate, the World Health Organization that has the mandate. OCHA and other international organizations are positioned to respond and are doing everything that they can. OCHA has, and its relief web is putting out a lot of great information. It has put out appeals for support and is, you know, doing as much as it can, both to maintain regular ongoing programs in humanitarian crises, as well as to be positioned to help with any surge needs.
Okay, thanks, Maya.
Mm-hmm.
So there's a question, is Israel enforcing the wearing of face masks? Yes, they are. We are being forced to wear face masks everywhere we go. So I think if there are any other questions, maybe we'll give a few more seconds for people to write them in the chat. And I actually had a question that I'd like to ask. You said that trust was something that was very important in communities. And I was wondering, as humanitarian aid workers, if we're going into a community to work, how, in your experience, were you able to build this trust with the community that you had?
Well, you know, I want to first start with a caveat that in the countries that I've worked, I haven't been a local. And I think that's a major disadvantage, as well as a major advantage. And I think that a lot of what I saw my primary role to be is to sort of put on my anthropology glasses, to listen as much as possible, to give communities and individuals that they're serving an opportunity to really voice what it is that they need, and to feel safe doing it, right? To not just say, yes, I need this because I offered it, or somehow suggested it in the way that I described the program that I wanted to start, or, you know, the goal that I wanted to, or that I thought needed to be accomplished. And that's not something that can happen, you know, that trust building relationship isn't something that can happen over 1 or 2 meetings. It's a process. I usually represented a donor organization. And so I think my primary challenge was to ensure that even though I had to meet my own board, you know, regulations, and I had certain boundaries that I needed to work in within that context, both budgetary as well as policy, that I was really offering the community as much flexibility as they needed in order to meet their own to meet their own needs. And I think that by listening and over the course of a couple of months at least, we were able to achieve that in some cases. And I think that was one of the primary challenges.
Thanks, Maya, for that powerful reminder about listening. Another question that we have here in the chat: adapting to this new normal will really be a challenge for developing countries like the Philippines. What strategy do you propose so that the population will be able to somehow adapt to this?
Well, I think, going back to my presentation, I think the primary strategy is a community-based disaster risk reduction. And the Philippines is, I think, one of the leaders in the world in this. It was one of the first countries to establish this as national law. You see it at every level of government. Every community needs to have a disaster risk reduction unit. Of course, those units are, some are very active, some are more effective than others, but I think it's a great starting point. If we go back to that first slide that with all the different wires, where to begin, I think that in a country like the Philippines, you have that unit, you have that infrastructure in place to begin with, and you can use that as a vehicle to bring community members that have already come together in some sort of capacity. And if they haven't, to bring them together for the first time and to say, okay, we have a situation right now that is likely to be ongoing. We also need to prepare for other hazards that are very popular in our region. And it's time to think right now, not just about the immediate emergency response and needs, but also about the longer term recovery, and to think about how we can self-organize now so that we can respond a month from now, 2 months from now, a year from now, and really bounce back from this in a way that could be even stronger than what they came into.
Thanks, Maya. Then we have a specific question from Hugo from Guatemala. He says, we have 22 different languages in a small country. How do you suggest to work with outreach strategies?
That's a great question. And I think that there have been a lot of, in the news, a lot of sort of failed experiences with this and a lot of lessons learned. I recently took a course that was offered on lessons learned in Ebola, and I learned different techniques from that course. I think, ultimately it really depends on that country. I think it's on resources available. I think it's crucial to address this right away. Even though the infodemic piece was one of the last slides in my presentation, ultimately in the world that we live in, it is of primary importance. If you, and it sounds like, if I heard it from her correctly, it was 22 languages. It sounds like you need at least a minimum of 22 different communications plans. And also to keep in mind that there's different levels of literacy, and perhaps illustrations are needed, as you can see on the screen. And that might also impact the timeline for executing such a communication plan. It's important to tackle that now with people who are familiar with the language and the culture that it represents.
Okay, this is another interesting question. When there's conflict between national politics and critical health guidelines, what can health professionals do?
So when there's conflicts between what?
National politics and critical health guidelines. What can health professionals do?
I would like to, I think prefer for a health professional to respond to that. I think ultimately this is where and why we have resources like the World Health Organization that are coming out with very good, detailed procedures for how to manage this crisis. The politics piece is something that's incredibly challenging. I don't want to minimize that. And it's certainly case by case, and something that does have capacity to make or break response, unfortunately.
Okay, so I think that's the time that we have for today. I'd like to give a really big thank you to everyone for joining us for this really powerful and interesting conversation and presentation that Maya shared with us. And Maya, maybe I'll leave you with some final words if you'd like to say anything. I'd like to give you a really big thank you for spending some time with us, and thank everyone as well for joining us. And it will be this session is recorded, as I said, so we'll make sure to put it up on our website.
So thank you, Sarah, and thank you to everybody on this call that took the time to be and to participate. It's a very competitive market these days on Zoom, and so I'm really grateful that you took time from your precious day to be with me. I think that recently I saw something that went viral on social media that said, you know, we're all in the same storm, but but we're in different boats. And I think that certainly speaks to the challenge of the humanitarian response, as well as to the situation that all of us are in today, participating in this call. And I really encourage all of us to take a step back and to try to think through how this is impacting our neighbors differently, how this is impacting different parts of vulnerable populations in various parts of the world. And I think by doing so, we can together think through what is this new normal? How can we manage this together? And what is the appropriate role for communities in getting us through this? Thank you.
Thanks so much, Maya. Thank you. Thank you, everyone, for joining us. And please join us. We have a lot of other great lectures coming up. And once again, if you'd like to re-look at this presentation, we'll have it up online. If you have any questions or any comments, of course, you have our email. Through your registration, you received our email, so please feel free to reach out. And once again, thanks to Maya for joining us today.